Thank you again for joining us today. Once again, we are sitting here in one of the observation pods of the Cross Insurance Center, where yet again we will be giving out several thousand vaccines. The crowd it's nice to see. We have a lot of young people here today because, of course, today is the first day that 16 and over are eligible to be vaccinated in the state of Maine. I'll start off with some numbers. As of this morning, we have 9 patients in our inpatients who are inpatients across our system who are positive for COVID-19. 5 of those are at Eastern Maine Medical Center. 1 is at Mayo Hospital, 2 are at Mercy Hospital, and 1 is at Sebasticook Valley Hospital. We are also caring for 6 individuals who are positive for COVID-19 at their home through our home care and hospice unit. As of yesterday, we have vaccinated a total of 143,910 doses given. That represents 87,740 first doses and 56,170 second doses. As we start accepting appointments for people 16 and 17 years of age, you'll notice that these appointments are not available at all vaccination sites. At this time, only Pfizer is authorized for use in people under the age of 18. Because of this, these appointments have been limited to sites that can administer the Pfizer vaccine, meaning that sites that have access to ultra-cold freezers. We know that this is challenging, but encourage you to make plans to visit a Pfizer vaccine site. At this time, Northern Light Health sites giving Pfizer vaccine include the Cross Insurance Center in Bangor, the Portland Expo in Portland, the Piscataquis County Ice Arena in Dover, and Northern Maine Community College in Presque Isle. Our online scheduling tool is set up to ensure this age group has access only to the Pfizer vaccine and should easily walk you through this process. A patient consent form needs to be signed by a legal guardian, which is included in the link in the registration tool. However, a parent or a legal guardian does not need to be present with them when they are vaccinated. We have received several questions from the community about why we include a question about religious affiliation as part of the registration process. Tracking specific demographic information for the CDC is part of ensuring fair and equitable distribution. While it is helpful if people answer these questions, many of them are not required, including disclosing religion. Unfortunately, ultimately, we have a lot to celebrate with the expansion of vaccination eligibility to those over the age of 16. That said, the pandemic is far from over. We've lost too many Mainers who could not get vaccinated in time, and we know that families continue to feel the impact of this virus every day in many ways. We must remain vigilant. I want to take this moment to remind all eligible Mainers to please get vaccinated. It is safe, effective, and could save your life or the life of a loved one. Currently, just over 40% of eligible Mainers have received their first dose, but we have a long way to go until we reach the threshold for herd immunity. While the COVID-19 virus has ended the lives of 555,000 people, there have been no reported deaths from any authorized vaccine. In fact, severe reactions, including anaphylaxis, are extremely rare, and all of our sites are prepared to handle such emergencies if needed. In short, these vaccines are safe, and the risk from COVID-19 is far greater than the risk from vaccination. Summer is just around the corner, a time to be spent with family and friends enjoying all this state has to offer. However, we won't be able to safely visit with others or take in the state's many festivals and fairs this summer or even fall unless more Mainers do their part to become vaccinated against COVID-19. Help turn the tide and do your part by getting vaccinated and continue the appropriate safety guidelines such as masking, physical distancing, and washing your hands frequently. And with that, I'll open it up for questions.
Thank you, Dr. Jarvis. Kicking off questions today, we have Melissa, ABC7 Fox 22. Melissa, you should be able to unmute now.
Hello, hi. So can you just go over the location sites that are offering the vaccine? You said Northern Light Health, and what are the other location sites?
So the Cross Insurance Center, the Ice Arena in Dover, the Northern Maine Community College in Presque Isle, and the Expo in Portland.
Okay, great.
Ben, I can't hear.
Another question I have is, I got a call today. Someone has a family member at Eastern Maine Medical Center, and they're not giving out the vaccine there. And why is that?
So right now, as far as inpatient care goes, we are not vaccinating people, particularly with their first dose of either our Pfizer or Moderna vaccine. and that's a clinical decision. The rationale there is that many people who are acutely ill, it is not the most appropriate time to give them the vaccine. We have, on a case-by-case basis, looked at giving people their second dose if it is due at that time. But right now, particularly with the things that we have talked about in the past of the handling of the Pfizer and the Moderna vaccine, it is difficult to do so. Remember, both of those have multi-dose vials, meaning that we have to give out several doses of vaccine at a time in order to not waste any vaccine. That is logistically difficult to do within an inpatient setting. We do know that we are working towards being able to do that more readily and work in conjunction with both the federal and state CDCs as guidance becomes available for us to do so. But at this time, from a clinical decision, we are not, as a routine, giving out first dose vaccines to people who are inpatients.
Thank you.
Thanks, Melissa. Next up, we have Ryan Sullivan, WABI. Ryan, long time no see.
Yes, thank you both. I guess, Dr. Jarvis, how many vaccinations do you expect, as you currently have scheduled, to give out over the next week based on the new expanded eligibility? And could you tell us what you think the next natural progression might be for Northern Light Clinics, maybe specifically the Cross Center, if there's anything?
Sure, Brian, that's a great question. The question was, with the new expansion in age eligibility, will we be changing our processes and how much vaccine are we going to be giving out? So remember, when we talk about vaccine dosages at any one of our sites, we usually combine our first and second doses together. And so that's really how the difference is. Across Insurance Center has the ability to be doing about 3,000 vaccinations each day. And that's what we will continue to do 4 days a week going forward. Our other sites, not quite as large, but certainly across the enterprise at Northern Light Health, we have the ability to do 10,000 or more first doses each week, and we will continue to do that. Again, variability depending on how much vaccine comes into play, as well as staffing and other issues. We will continue to adjust both our times and our days for our sites across the state to meet the demand. Right now, the demand is high, and that's great, and we are meeting that demand as best we can with the vaccine that's allocated to us. As conditions change, we will appropriately change and meet the needs of the state. As I have said multiple times, we will stay open, and we will continue vaccinations until every Mainer who wants to be vaccinated is vaccinated. Thank you, Brian.
Thank you.
Did you have a follow-up question, Brian?
No, I'm all set. Thank you.
Okay, thanks. Next we have Dustin, NECN, NBC Boston. Dustin, you should be able to unmute now.
Thanks. First, Dr. Jarvis, is Northern Light seeing more hospitalizations and positive tests among young people at its facilities across the state?
So that's a great question. And of course, we follow trends. Right now, with the number of inpatients that we're talking about, obviously it's much lower now than it was at the beginning of the year, and that's fantastic news. We are seeing a trend across the United States and somewhat here in the state of Maine that the average age of the people who are being admitted is younger than we had seen previously. There's probably multiple factors for that, but we attribute some of that to the fact that many people in long-term care and nursing homes were vaccinated, and we've seen far less outbreaks in those areas, and they tend to be an older population, and that's good news. The bad news is that we are still seeing people who are younger still getting sick and sick enough that they need to be hospitalized. And again, that should be a warning to all of us that that's why vaccination is so important. We've heard from numerous people who say, oh, I don't need to get the vaccine because I'm young, I'll stay healthy. And that's not exactly true. Young people can get very sick with the disease and in fact die from this disease. That's why vaccination is so important. So thank you for that question.
And sort of building off that, are you then encouraged by the eligibility expansion for folks 16 and older today because so many young people will be in that group?
Yeah, absolutely. We are so encouraged by being able to do this. And again, as I look down the rows of people who have been vaccinated already today, lots of young people out here. It's great to see. Many of them are coming in groups of friends, which is great because they want to get back together. They feel that if they can get vaccinated now, maybe in a few weeks they'll be able to actually go out together, eat at a restaurant safely, go and participate in activities that young people love to participate in a safe manner. And that's really what we're looking forward to here. So we're excited about that. And of course, any expansion is good news for the state of Maine because the more Mainers we get vaccinated quickly, the sooner we can get back to a normal life. So thank you.
Thanks, Dustin, for your questions. Next up, we have Eric Russell, Portland Press Herald. Eric, you should be able to unmute now.
Thank you, Dr. Jarvis. I had a quick follow-up question on Dustin's question. Do you have any way to quantify the average age drop? I mean, can you say if there's any way to say this is what it is now, or this is what it is in March versus January or December, something to quantify it at all?
Yeah, and that's a good question. I will say that, myself being a scientist first and a physician second, I like to see large numbers in order to make any, particular data sets. So across Northern Light right now, because of our smaller numbers of hospitalizations, I would prefer not to do that. I will refer you to the Maine CDC. The Maine CDC collects the data for the entire state, and therefore it's a bigger number for you to actually tease out whether or not the trends that we're seeing are factual or accurate versus just anecdotal. And right now I can only provide anecdotal evidence, and I just prefer not to do that.
Okay, and your anecdotal sense is what you said before, that you're still seeing younger people getting sick and sick enough to be hospitalized. That still holds true.
That is correct.
Okay. The other question I had, this is a little bit broader, but I wonder if you can reflect a little bit on, the last year and, the death rates, particularly in Maine. And, we've been much lower than the national average. I think we're the fourth lowest in the country for COVID deaths. And I wonder, with Maine having such a high percentage of older folks who would be at the highest risk of death, what are some of the factors that have let us avoid as many deaths as we have? I mean, 750 deaths is still a lot. It's way too many, as everyone would agree, but it's still, comparatively, we've done pretty well. And I wonder if you can reflect on that.
Yeah, so I agree with you. 700 plus deaths, especially when we have ways of preventing it, is very sad for our state to have to talk about. It's almost 6 times what we typically see in an influenza season. And so I want people to understand that that's important. Certainly geography in Maine has played a role in preventing the spread or limiting the spread of COVID-19. We're a big state with a population density that's lower than most other states. But really, I take the credit for the Mainers. Mainers stepped up from the beginning of this pandemic. Governor Mills initiated executive orders sooner than many other governors did. The state of Maine closed its schools before the city of New York did, where the epicenter at the time was. And people stood up and started wearing their face coverings very early on. Learned to do social distancing practices, washed their hands, and limited congregating in large gatherings. So I applaud Mainers. Mainers always think about their community first. It's why we're talking about vaccine now. Vaccines are not just to protect yourself, it's to protect everybody you come in contact with, which means our community. And the state of Maine is a small town. We are one giant community in the state. We stand up for one another, and that's what we're doing. And I really think that's why we've seen the tremendously successful programs across our state. But I will still say, it's sad. There's lots of families out there mourning the loss of lives of loved ones. Let's not have any other families added to that list. Please get vaccinated.
Thank you.
All right, thanks, Eric. Next, we'll go to Mary Kate, WMTW. Mary Kate, you should be able to unmute now.
Hi, good afternoon. If I could ask a question on behalf of a colleague who's covering the expansion today, obviously a big deal, but was curious if you're seeing more Mainers, younger Mainers at the sites since the eligibility is dropped, and if there would be parents of teens in that age range and what you think would be helpful for them to know.
Yeah, so we are seeing lots of younger people come in and be vaccinated today. I can see several of them smiling back at me right now, which is great. I got a couple of waves there with that shout out. So it's wonderful to see that. It's really good news. A recent study showed that 4 out of 5 adults in Maine who have not been vaccinated intend to get vaccinated, with a large proportion of those between the ages of 16 and 30 eager to be vaccinated in our state. That is way better than most other states. It's we should applaud the fact that Mainers are standing up. So it is joyful to see that. What I want to tell parents out there who may be concerned, these vaccines are safe and effective. The Pfizer vaccine certainly is safe for people 16 to 18 years old. It has been tested, tried, and true on that. And all of the vaccines approved in the United States have been used now in hundreds of millions of people around the world. We are seeing no ill effects from that. What we are seeing is that people who've been vaccinated are far less likely to get sick. If they do get sick, they are far less likely to have severe disease, be hospitalized, or die. And isn't that the endpoint we're all looking for? Prevent people from being sick, prevent people from dying. You can help save your child's life, and your child can help save somebody else's life by not spreading the disease to somebody else who may be at high risk. So thank you for that, Mary Kate.
Thank you. If I may, could I ask a second question?
Absolutely.
Sure, and I apologize. This one is on behalf of producers at my station. Are curious if you've seen a study. It was released back in February, sort of small, but discussing that many COVID-19 patients who have long hauler symptoms are experiencing PTSD. Is that something that you have seen or have any thoughts on by chance?
So again, we're fortunate in the state of Maine that our overall numbers of people who've been infected with COVID-19 are lower than most other places have seen. But we have some anecdotal evidence that yes, indeed, we are seeing that, especially with individuals who were severely ill and thankfully recovered, that they are still having concerns. I've shared a story before about one of our own employees, a provider who unfortunately continues to suffer with symptoms several months after their initial infection. This is a real thing, and we need to be concerned about it. Even more concerning is recent data now that shows that up to a third of individuals who have been infected with COVID-19 are suffering cognitive conditions 3 months or more after their initial infection. While it's more common in people to have cognitive deficits who have been severely ill, we are still seeing that in people who have had mild illnesses as well. So again, this is a serious illness. Coronavirus will find a way to hurt us in many, many ways. And so let's avoid that. Let's avoid getting sick. Let's wear our face coverings. Let's be socially distanced. And let's get vaccinated.
Thanks, Mary Kate, for your questions. Now we'll go to Mal, WGME. Mal, you should be able to unmute now.
Great. This question is for Blair Best. Many non-English speaking Mainers are unable to book a vaccination appointment because when it comes to selecting a location, time, etc., it's only in English, and this might be getting in the way of people being vaccinated. What's your response to this, and what are you doing to make an appointment easier for non-English speaking Mainers?
So we do have the ability to do translation services over the phone, and so I encourage people to still use the phone service for if English is a second language for you. Also, reach out to community members. There are so many people out in our community who are assisting their friends, neighbors, and family to get scheduled for vaccination. We continue as Northern Light Health to do outreach into many communities. Our friends down at Mercy Hospital have done a great job. They've actually put videos together in multiple different languages that explain the process, how people can get signed up, and to explain that these are safe and effective vaccines. And so I encourage people to visit our website in order to be able to find those videos and learn more about that process. Reach out to your local clergy, community leaders, libraries. All of them have the ability to do assistance. And then, of course, we have our home care and hospice people who are actually going and setting up pop-up clinics in neighborhoods of people and communities who have been disenfranchised or in some way have had not been serviced by the healthcare system as we would like that to be. So we continue to make that outreach. We understand that our website is limited, but again, as I've said before, we are a healthcare company. We're not a website design company. We are not a construction company. We are doing the best we can with the challenges that everybody faces with COVID-19. We celebrate the fact that we have been successful with so many Mainers getting vaccinated, but we need to do more. And if you're out there and you know somebody in your community that may have trouble because of English language, disability, or any other concerns that would be a barrier for them to get vaccinated, reach out to them and say, hey, how can I help you? Because there are many avenues for you to get in the door at any site across the state of Maine. It doesn't have to be a Northern Light site. So thank you for that very important question and very important issue.
And then my second question is, right now we're seeing an uptick in cases, especially in people in their 20s and even younger than their 20s. They're leading for the cases in Maine. Can you talk a little bit about why this expanded eligibility is coming at such an important time for the state?
Well, it's very important. So we have a couple of factors that are happening. We had some winter break issues, we had spring break, and soon many of our college students will be returning home either because they were out of state and are coming back to Maine, or they live here in Maine during the college season and return back to their homes across the country. That's a recipe for spreading the disease. The more travel that we see, the more likely that people will come in contact with somebody who's infected, and then when you get infected, you can infect others. So this is wonderful news that we're able to decrease that eligibility age so that we can get people vaccinated, particularly our college and university students, before they start heading home for the summer months, but also so that we can make sure that everybody's vaccinated so that in the fall we don't talk about school closings, whether at the university level or at the high school or elementary school level. We want kids to be in school. Their education is important to all of our futures, and not only that, we want them to be safe, healthy, and live longer, happier lives. So important comments.
Thank you, Mal, for those questions. Next, we have Cindy Williams, News Center Maine. Cindy, you should be able to unmute now.
I am. Thank you so much. You mentioned this a little bit ago, but we do know that it's possible for people who are fully vaccinated to still test positive for COVID-19. I'm wondering if you are seeing people present symptoms, how severe they are, and do you have any percentage on how many end up being hospitalized?
Yeah, that's a great question, Cindy. So right now I'm unaware of people who have been fully vaccinated, meaning that they've received either their dose of Johnson & Johnson or their second dose of the Pfizer or Moderna and waited that 2 weeks and actually then contracted COVID-19 to be severe enough to be hospitalized. I'm not aware of any cases where that's true. We have had some isolated cases of people who have received their first shot or just recently their second shot and then been infected with COVID-19 and needed at least outpatient care. So remember, no vaccine is 100%, but what we do know is these vaccines are incredibly effective in preventing people from having severe disease and particularly hospitalizations and death.
Do you have any national numbers on that as far as hospitalizations post-vaccine?
I don't, Cindy. I just know what's been out there that you guys have reported and what I've seen on the CDC site. I recommend that you follow up with the federal CDC to see if there's any, if there has been any reported cases. I certainly am not aware of any reported cases of death after somebody who's been fully vaccinated.
Okay, Dr. Jarvis, thank you so much.
Thanks, Cindy. Charlie from Maine Public is having some internet connection issues, so he sent me his questions, Dr. Jarvis, and I'll read them to you. His first question is, what are Northern Light providers doing to target vaccines to eligible people with underlying health vulnerabilities, such as diabetes and cancer?
Yes, that's a great question, and we know we need to reach out more to people at high risk. We started with an age-based strategy because we know that people as they increase in age, we're far more likely to need hospitalization or die from COVID-19. But we also know there are other high-risk conditions. People who are obese, people with heart disease, lung disease, people being treated for cancer, pregnant women. We know that they are at risk for more severe disease, and so we encourage all of them to be vaccinated. In addition to that, Northern Light Health, through its Beacon Health Department, has been working diligently to make sure that we can reach out now to individual patients who are at high risk. Now that the age restriction has been lowered down our age of eligibility is lowered down to 16, we can do more outreach in the areas of people who are at high risk, and we will be doing that. And as I know, other health systems across the state are doing the same thing. Again, if you're somebody who is at risk, we encourage you to go into our website or call our hotline and try to get yourself set up for a vaccine. Demand is high right now, and so we know it's going to take time. I ask for people's patience, but we will get to them.
And then Charlie's second question is, how has the vaccination of Northern Light Health's workers changed what precautions they must take when seeing patients, moving about the hospital, etc.?
So right now we have not changed our precautions based on people's vaccination status, and there's a number of reasons for that. One is that we're waiting for more formal guidance from both the federal CDC and the Maine CDC, but also because we never know who's been vaccinated and who's been not when it comes to the general population, particularly with initial contact. And so we continue to take those precautions. As I've said before, at any one of our vaccination sites, we treat them as if it's one of our hospitals, and so it's the reason why we require everybody to wear a face covering, particularly a hospital-issued face covering, and we wear eye protection, and we continue to maintain all of the infection prevention control aspects that we would at any other facility. I want people to understand it is safe to come into our hospitals, our clinics, and our vaccination sites. We keep them as safe as possible because we don't want to spread the disease either. And so we will continue our precautions. We will continue visitation restrictions as long as we need to. As more people get vaccinated, we may see those restrictions change.
It looks like we've gotten to everybody today, so we'll consider that to be the final question and wrap things up. I'm not sure that I mentioned this at the top, but we do have a high-quality video file of today's press conference. That'll be available. It usually takes about an hour or two. If that's something that you would like, just let us know in the chat or send us an email after. We'll make sure that we get that over to you as soon as possible. As always, we thank you for joining us today and helping us spread the word. And to close it out today, Dr. Jarvis, you can have the final word.
Once again, I just want to say thank you to the media for helping us to get our word out. It's important. We need to be sharing this message. If you have any concerns about being vaccinated, please reach out to a trusted and respected source, your primary care provider, a community leader, a trusted and knowledgeable friend. We are here for you to answer questions, and we will continue to vaccinate until every Mainer who wants a vaccine gets a vaccine. With that, I'll say thank you and have a wonderful afternoon.